Hello, everybody. In this section, we will be talking about the antibiotic linezolid. It's first in the class of oxazolidinones. It acts on the 23S ribosomal RNA of the 50S subunit, so it interferes with protein synthesis. It is considered bacteriostatic against enterococci and staphylococci, but it also means it has activity against both of them. It's an antibiotic which is generally of use for drug resistant gram positive bugs. It is also useful for drug resistant TB, where among the drugs, it is one of the favored drugs in combination therapy for multi drug resistant tuberculosis. It has activity against streptococci, where it is actually considered to be bactericidal. The drug is available as an oral formulation with excellent bioavailability, almost 100%. And this makes it an excellent proposition because many patients with gram positive infections like with staph would require weeks and weeks of therapy. Otherwise, it's available also as an IV formulation of 300 ml containing 600 milligrams of the molecule. Now, what are the clinical situations where we would be thinking about using linezolid? For MRSA. And when vancomycin resistance is shown or is not tolerated, that is the place where probably we will be using for MRSA. Except maybe when the patient has a pneumonia, where maybe we might favor either vancomycin or linezolid as one of the drugs. But when it comes to very serious gram positive infections, vancomycin is preferred because it is a faster kill rate and also because linezolid is considered bacteriostatic against Staph aureus. It has activity against enterococci, including the ones which are vancomycin resistant. And as we said, for multi-drug resistant tuberculosis. In terms of infection sites, skin and soft tissue infections, pneumonia, central nervous system infections, bones and joints, intra-abdominal infection, you can use it everywhere. Intra-abdominal mainly because enterococci could be one of the organism. Urinary involvement is generally related to devices like with staph and enterococci. But the urinary excretion of linezolid is small, around 30%. So maybe when it comes to treating urinary infection, it's better to choose an alternative agent. What are the cautions with the use of linezolid? But it has reversible inhibitions of the MAO inhibitors. So there could be the serotonergic kind syndrome with this drug, although not considered to be very significant, but it's something to be kept in mind. And it can cause myelosuppression, especially when used for longer duration. So keep a check on the blood counts when you are giving linezolid, especially for a longer period of time. In our clinical use, we can keep linezolid as a reserve drug for drug resistant gram positive bugs, especially MRSA and vancomycin resistant enterococci. The most appealing proposition is the oral bioavailability of the drug, availability as an oral formulation, and an acceptable side effect profile.